Good evening. Welcome to Expat Insights. I'm your host Raju Mandhyan. Here at Expat Insights, we take external views of internal successes by foreigners, expats and immigrants who have made Philippines their home. Over the last few weeks, we have been talking to social entrepreneurs, businessmen and other people who have done good in the Philippines. Today we have two guests who come from the field of biotech, and we are going to talk about regenerative medicines. My first guest is an Englishman, James Thornton, and he has spent several years in the publishing industry and the international direct marketing industry. My second guest, his associate and friend, Polish by birth, American by practice, Brian Dardzinski from Pennsylvania, and they are my guests here today. So welcome to Expat Insights.
Thank you.
Thank you, Raju.
So give us a background about yourself a bit. You and the Philippines, what are you doing here? What brought you here, James?
Well, I've been here for longer than I would care to admit, but if I'm going to be truthful on this program, I'll tell you the truth, which is I've been here 20 years. And I was in a direct marketing business with an Australian, and we just had to decide whether to start a direct marketing operation in Thailand or in the Philippines. And we decided that the Philippines had better golf courses, and there weren't quite so many people playing golf on those courses as there were in Thailand, so we decided to come down to the Philippines.
It's easier to sell on golf courses than to sell outside of golf courses.
Well, we weren't. I mean, the direct marketing that I do is all in here.
Yeah.
And we've never done business within the Philippines. We do business from the Philippines to the world. And we established what is called an EO226.
Oh, the license, the investment license with the Board of Industry.
Regional headquarters.
Yeah.
So we set up a regional headquarters here in the Philippines, which doesn't allow us to do business locally, but it allows us to do business from the Philippines.
Outside of the Philippines.
From the Philippines to the world.
What product were you carrying, or what was there any special?
A series of products and services, mainly in the publishing area, newsletters and books and so on. I'm basically a publisher at heart.
Right, and now you're into a different field with Mr. Brian over here. So Brian, tell us about yourself.
Well, I'm from the United States.
Yeah.
So I grew up on the East Coast and went to college on the up in Boston.
Yeah.
And always been interested in high tech fields. So I was involved in chemical waste in California for about 15 years.
As in, like, were you creating it or were you getting rid of it?
Yeah, we were getting rid of it for some some very large multinationals.
Yeah.
And then had an opportunity to come to Asia to work on a project in 2003, and ended up staying in. I was doing work in Singapore and ended up staying in Bangkok at the time. Yeah. And then I was exposed to actually a stem cell company. My father had a heart attack, so I was doing some research on regenerative medicine, and I was a biology pre-med major in college, so I was familiar with the science. How long
ago was this?
This was in 2004.
Well, not very long ago.
So it was about 8 years ago.
Yeah.
And I went and met with the CEO of the heart stem cell company, and
this is in Pennsylvania?
It's in Bangkok.
Oh, Bangkok.
In Bangkok, and then set up my own kind of medical tourism business, and I was sending patients to Bangkok to get heart stem cell therapy, and the executive, the CEO at the time, decided to hire me on as VP for that company. So.
Yeah.
So I was commercializing the stem cell product throughout Asia. So I was spending a lot of time in Singapore and various countries in Asia. And then I ran across this guy's stem cell company, and we started talking, and then I started representing the stem cell company in Thailand, and then I ended up becoming part of their team.
We will take up stem cell and stem cell research and stem cell therapy in detail in a while, but I'd like to have your views on Philippines, especially you, James, since you made this home, so you have invested some skin and money into this country. And what makes you do that? What makes you like this country?
Well, I think one of the fundamental things I like about the Philippines, being a British guy, is I like to be warm, warmer and warmest.
So this is a good day for you, Sunday. It's
I love
hot.
it.
Yeah,
I love
really?
it. I love the warmth and I love the heat.
Yeah.
And I'm a simple guy, you know, simple things. And I think it was that, plus a very attractive regional headquarters deal, which brought me here with my partner
the publishing,
at the time.
publishing business.
The direct marketing business, really, doing things from the Philippines. And we built up a staff here, and we found that the Filipinas, mostly Filipinas, less Filipinos, were very devoted
To work or to the profession, to the special
to
industry?
working for a couple of foreigners.
Right, right.
I think
Good service.
And the service was I've had some bad experiences, but very few.
Yeah.
So the workforce has been benign and devoted.
Yeah.
And the thing has worked, and I find that it's a very laid-back country, a very informal country, and I, until I had problems with my leg,
All right.
I used to play golf twice a week, and my partner used to play golf 3 times a week. So you know, it's the simple things that brought us here, and the simple things that I think have kept us here. And the business was very successful.
Now together you are in the stem cell research and stem cell therapy. So would you define for me and my audience what is stem cell research and what is stem cell therapy, if they are different or are they the same thing? Research is one, of course,
sure.
Research, and therapy is the application of it.
Yes.
So would you give us a background, what it means and what it is all about?
Yeah, sure. So research is taking cells. There's 2 broad categories. There's embryonic stem cells, and then there's adult stem cells.
Yeah.
Embryonic stem cells come from fertilized egg and sperm. We don't deal with that. We deal with only adult stem cells.
Your company.
Yes,
your
our company.
Okay,
So
but just give us a background, a broader picture before what you.
So the stem cells were really identified back in the late 80s by James Thornton, who's from the University of Wisconsin, and he termed the word embryonic stem cells. So they're cells that can virtually divide and become any type of cell in your body.
So it's not a basic blood cell or a skin cell, it's something beyond a basic blood cell and a skin cell?
That's correct, yes.
It's something smaller?
It's a little bit smaller, and essentially the cell is, you can think of it as the repair cell in your body. Right. So they're in every organ in your body. They're in your brain, they're in your lung, they're in your heart, and they're also in your bone marrow. Many people who are watching the show are probably familiar with bone marrow transplants.
People watching the show might be aware of bone marrow transplants? Okay.
Yeah, so bone marrow transplants are, they take some bone marrow from your hip, and they isolate the cells out of those, and usually they give them to cancer patients. So after you get chemo, they'll give you the bone marrow, which has, they didn't know this back in the 60s when they started doing it, but it has regenerative cells, and they go and help repair your body quickly after chemotherapy.
Okay, well, let's take a break here, and after the break we'll come back and we'll also show a video which was provided by you about what stem cell is, and then we'll come back and talk some more about it. So stay with us. I'm your host Raju Mandhyan, and we are with James Thornton and Brian Dardzinski. Good evening, welcome back to Expat Insights. I'm your host Raju Mandhyan. We're still talking to James Thornton and Brian Dardzinski about regenerative medicine, and Brian was just telling us about what stem cell research is. Brian, you can continue and tell me what it is.
Okay.
In depth,
So you were talking about research and the clinic. So basically you can take cells from the patient. It can come from blood, bone marrow, or fat. Right. And our company is we call it a fat stem cell company. And
call yourself a
fat stem cell company, yes. So there's bone marrow stem cell companies.
So just because you pull it out from
fat, it's where you source the cells from.
Okay.
So wherever you get the cells from the patient, that's kind of the category that you fall into. So the research is what you do in the lab to kind of look at the cells, see what they're going to do. You can do animal models. You can put the cells into a rat, say that has a spinal cord injury, and then watch the rat repair itself and be able to walk again.
Wow.
So that's the research side of things. So you're actually doing stuff in the lab. So we have our lab in Australia. And then once it gets to the point where it's ready to go in people, then you do clinical trials. We have 3 clinical trials that are undergoing right now. One is for osteoarthritis, where we take the stem cells from the fat in the abdomen and we inject it into the knee. Or
so if I have a shaky knee, if I have cartilage problems, or just bone, so that's one of them.
Yes. So we can take the cells from your abdomen, we process them, and then we inject them into the knee, and then they start to regenerate the damaged tissue that's in your knee. That's regenerative medicine. So that's a clinical trial. We have another clinical trial for idiopathic pulmonary fibrosis that's going on in the EU, which is lung disease.
Say that again.
Idiopathic pulmonary fibrosis.
Idio as in like I-D-I-O?
Yes, idiopathic pulmonary fibrosis. So it's a terminal disease. There's no help for it.
It's like tuberculosis?
Yeah, you get nodules on your lungs. You have about a 2-year lifespan. So you're better off getting cancer. It's a very, very quick progression disease. So if somebody says they have IPF, most likely they're going to die within 2 years. So we started treating some patients in the EU using their fat stem cells, and we saw some very good results. So we have a full clinical trial that's underway. Will be released in Amsterdam in October.
And the third one?
And the third one is autism. So we are treating children that have autism. We have a clinical trial going on in the EU with 46 children, and we take some of the fat from the child and we give them an IV of their stem cells.
Let's pause for a while because we have that little video on what stem cell research is, and we'll come back and discuss this further.
Human body is composed of over 200 cell types, each designated to say.
All right, there we go. So Brian, that was a very generic video which I picked up from YouTube. What are your views on that? The questions that they had raised in that video about stem cell research. Where do you come? Where do you fit in? And how much of that is relevant to what you do?
Well, it was a good overview. Differentiating between embryonic and adult stem cells. They made some assertions about embryonic stem cells are required because they can grow neurons, and that was basically kind of old science. Adult stem cells, we've proven, and we actually have tagged our stem cells, and they do go up to
embryonic. Tapping into embryonic stem cells is old school.
I think the science or using it to treat patients right now it's just not ready. It is someone else's DNA for the most part. They're using an egg, fertilized egg from IVF. So someone else's DNA is not going to know how to work in your body. There's literally 3 billion sequences, in the DNA code, and the more science learns about DNA, the more complicated it becomes. And so using your own cells to fix you seems like it's going to be the way that science of regenerative medicine is going to go. They talk about using it for drug discovery. I think that's a very good use for induced pluripotent stem cells, where they're taking
not
genes.
For healing individuals or healing individuals.
Yeah, I think we're 10, 20 years off.
Maybe 1,000 years.
Yeah, I don't know if it'll ever work. I think people's DNA is substantially different, and the body is so complex that using another person's DNA to try to fix you is opening up a
dangerous.
Pandora's
I think that's
box.
where the ethical issues come in, no? But before we go into the ethical issues behind using embryonic and using adult stem cells, no? What is the global perspective? What is the global awareness on stem cell therapy? What is the legislature? What is happening across different nations? Can you give us insights on that?
Sure. From a business standpoint, we are a disruptive technology. We're changing the way doctors are going to be treating patients. They're going to be using their own cells, and they're actually going to be regenerating or healing a patient and getting them, we'll use the word cured. And current models use, they treat symptoms. You take pills for your disease. Say you have type 2 diabetes, you'll be taking pills forever, insulin. And what's happening with adult stem cell therapy, there's about 500 stem cell therapy companies around the world, and the end point is cure or regenerating or fixing the tissue that's been broken or doesn't work anymore. So say for heart therapy, when patients were treated with stem cells for their hearts, they stopped going to see their cardiologist, which created a lot of financial issues for people.
How? Can you explain? Can you cite an example?
People with, I'll give you an example.
Say I have blood pressure, or I have a weak heart or a big heart, yeah?
Okay, you're going to be on, say, 25 different prescriptions a day.
Wow.
You're going to be going to your cardiologist every week, every month.
Right.
And you're going to be constantly on the treadmill of new drugs.
Right.
That's your.
That's the normal. That's the old
normal.
way.
That's what happens.
Right.
Unless you get a new heart, and then even if you do get a new heart, you're going to take more drugs for rejection
until
issues.
it adjusts. Yeah.
Yeah. So, if you get cell therapy and it works, it doesn't work all the time, but if it works, your heart's going to be better, and you're going to be off your medication. You're not going to be going back to your doctor, and you're not going to get, say, a triple bypass to replace your arteries. You know, you're going to be better. So the model, the financial model for the healthcare industry needs to be worked out a little bit more in detail, because patients are getting better. You know, patients are
with stem cell
therapy, and they're not going back to see, to see.
So what are the cons? Are there any
controversy.
cons to that? Are there any cons to that? Are there any side effects to that?
From
patients moving from basic therapy to stem cell therapy.
Side effects for.
I mean, as in, like, will there be any harm later?
The biggest concern is it may not work. So a patient, a lot of this stem cell therapy is not covered by insurance, so people have to pay for it, usually out of their own pocket. And in some cases, for some reason, it doesn't work. So we do one therapy and it doesn't work. The patients are very upset because they see other people that have a similar condition, especially if it's a life-threatening condition. They get better, and then they go online and it didn't work for me. As a company, what we're doing is we're starting to freeze some of the extra stem cells, and we're putting them in a bank. And then we'll give the patient, or the doctor will give the patient a dose, and then the patient will see what kind of improvement they have, and then they come back 6 months later, we take it out of the bank, and we can give them another dose.
Perhaps it's a good time to introduce Adistem, which is your company, because you mentioned Adistem a couple of times. So James, you are part of Adistem. So what is Adistem all about? Is that the correct way to call it, Adistem? Does it mean anything, Adistem?
Well, what it means, and Brian's used the word several times, the word adipose fat.
Adipose
so there are more stem cells in the adipose fat than in bone marrow or anywhere else in the body.
Yeah.
And so
in the waistline, you mean, in this midriff area? Okay.
Yeah. And so the mini liposuction brings out the fat, and then we isolate the stem cells from the fat, and we use light, the yellow, green, red light at certain frequencies to activate those stem cells, to wake them up because they're asleep.
Because they're fat asleep. And because they're not active, so they're not performing anything inside the body. Okay.
So we make them useful by bringing them out and then IV back into the body. Basically, I've been diabetic for a long time, since about '95, but it probably started before that. And my partner in this business is an Australian.
Right.
And he came up to the Philippines and stayed here for a while. And we worked with a doctor, Dr. Lucero.
Sorry, what's his name?
A Dr. Lucero.
In the Philippines?
In the Philippines.
Right.
And I was the first patient.
For diabetes?
I had diabetes. Very high blood sugar levels, 350 plus.
Yeah.
And so I was the first guy on the operating table in St. Luke's Hospital.
Right.
And
Dr. Lucero is still with St. Luke's?
He works in several hospitals here.
Yeah.
And he announced we're making history here today.
Yeah.
And doing the first stem cell procedure on me. I was willing to put my
own. Is that the company you now own?
Yeah, and so it worked. I mean, my blood sugar levels came down to normal after about 2.5 weeks.
Wow.
And that hadn't happened. I mean, that was just an amazing experience.
Yeah.
And gradually it picked up again because I didn't bank the stem cells. And so what we're doing now is banking stem cells. So that
your stem cells were taken from your midriff fats that time. So did you have to bank them? Could you not just start and get some more?
We do now, but we didn't then. This was early days.
Yeah.
This was 5 years ago.
Yeah.
And so I saw this result.
Yeah.
And so I decided to back him financially.
Yeah. Dr. Lucero.
So, no.
The Australian
Dr.
partner.
Paspaliaris, the Australian partner. And I decided to invest in a company to start doing clinical trials and so on. And I'd done quite well in the direct marketing business. And so I was the sole funder, and we formed this company called Adistem.
So today, what kind of issues does it cater to besides diabetes, osteoarthritis? Is there anything else that Adistem caters to?
Degenerative disease. I mean, we've had results on Parkinson's, we've had results on Alzheimer's. We've
and
had
your products
results
are
on
out in the
strokes.
market or not yet? They're out in the market as in like,
Yes, we're in 26 different countries right now around the world.
Wow.
So basically we consider ourselves, we're a scalpel for the doctor. And then depending upon the doctor or the hospital, they will pick up different treatments. So probably one of the most popular ones that we didn't think was going to happen was basically we call it a fat transfer, or a cell-enriched fat transfer, where we take out some fat, usually from a woman, and then the doctor will separate it into two samples, activate the stem cells from one sample, mix it into the other sample, and then they'll fill the fine lines and wrinkles on the face, neck, and hands.
For aging.
Yeah, rejuvenation,
anti-aging.
And the results are immediate. The women are very, very happy. I've personally seen.
So it's not just sicknesses; it's also looks.
There's also aesthetic applications. So so the fat transfer is really taking off. It's very simple for the doctors to perform. As an immediate result with the patients, you know, and it's a good, you know, a good way for people to understand that your own cells can help.
Is Adistem doing any work in the Philippines?
Well, we're not allowed. We're a Hong Kong company,
Right.
And we're not allowed to do business here.
And in the research, any development, any?
We did some research in the early days through Dr. Lucero, and on diabetes, about 27 diabetic patients, and with significant results. And we published those results. And this was our first clinical trial done in a hospital, and Manila Doctors Hospital, actually. So in a way, the Philippines was the seeding ground.
It was a place that helped you.
We started here because I lived here and my partner was here, so we started here. You know.
Well, all right. So we are thankful to this country for some reasons. No? Let's take a break at this point, and then we'll come back and we'll take up the ethical sides of this issue of regenerative medicine, and we'll also show the clip of the one that you talked about, taking fat cells and separating it. So stay with us. I'm with James and Brian, and I'm your host Raju Mandhyan. You're still watching Expat. Welcome back to Expat Insights. I'm your host Raju Mandhyan. We're still with James and Brian. We are talking about regenerative medicine, and Brian is now going to tell us something about the future of stem cell research. Brian, you want to start telling us what the future looks like for this kind of research that you're doing?
Sure, I'd love to. One of the components, or one of the things that we looked at once we started seeing results in the patients was what are the stem cells doing? What are they secreting? How, you know, what is that?
You mean to say beyond the cell there is stem cell, and beyond the stem cell there is something smaller, something much more micro or nano?
That's correct. That's correct. So cells talk to each other like you and I are talking to each other with our voice. Cells talk to each other with biochemicals.
Okay.
So they secrete stuff and they listen that way. That's how they communicate.
Yeah.
So our head scientist, Dr. Bill Paspaliaris, looked at what are these cells secreting to make your tissue regenerate.
It's not energy, it's not electrical signals, but it's some kind of emittance,
Yes, so it's a secretion or a peptide.
Peptide?
Yeah, so it's basically their proteins are made up of peptides, and that's how they're communicating. So
peptides is not like peppermint or something?
No,
okay.
Not
I'm just
Pepsi.
kidding you. Okay.
No. So they isolated in the lab what the cells were actually secreting and communicating with.
Yeah.
And then we started looking in the lab to see what would this peptide do if you if you applied it for topical purposes. And we found that it was a very, very effective pain reliever.
So instead of injecting it or intaking it, it's an application
Yes,
with stem cells.
Right. So
Okay.
we actually manufacture this small peptide, which is very similar to the natural peptide that your body is
Yeah.
creating with stem cells, and then we put
Like
it
a
into
penicillin ointment.
Mhm.
Is it like an ointment form?
Yeah, it's
okay.
a serum or a cream,
Yeah.
and if you rub it on your hands, if you have arthritis, it helps relieve the pain of the arthritis, or you can rub it on your knee.
So if I have a cartilage joint injury, I can heal it by an application?
You can help relieve the pain. It will
Not heal
Yeah,
it,
it won't
not-
heal it, but
yeah.
it'll give you some relief. So
All
if
right.
you have a sports injury or you injured yourself, and it will help release natural, what's called endorphins or natural morphine. So we have a product called PeptiRub that we're going to be launching
Yeah.
in about 2 weeks.
Yeah.
And basically it's derived on the stem cell technology. It's a natural peptide.
Yeah.
We've put it in a cream, and you can rub it on a joint. And I did it to my mom when she was visiting Asia about 4 months ago. She has arthritis in her hands, and she wasn't able to lift a gallon jug of water, and we rubbed
Yeah.
it on, and 45 minutes later,
Yeah.
her pain was gone.
Well, we are just getting ready to show that little video that you sent us about your company and how you actually do the stem cell research and application. Right after that, we'll come back and talk to you about the ethical sides of this
The
business. Is
following
that okay?
animation is designed
okay.
to provide a general
So let-
overview of the Adistem procedure. First, 100 cc's of pure fat is extracted from the patient's own abdomen. The fat contains millions of dormant stem cells, seen here in purple. Yellow is fat. The fat is then placed into test tubes. Adistem cell extraction solution is added. The fat and stem cells are then placed into a centrifuge and spun. This process gently separates the fat and stem cells. Here you can see the stem cells, in purple, have separated and are at the bottom of the test tube. Now the stem cells are transferred into one test tube and set aside. Now 50 cc's of blood is drawn from the patient to obtain platelet-rich plasma, or PRP. Whole blood is centrifuged, and their PRP is at the top of the test tube. The yellow PRP is removed and added to the patient's dormant stem cells. This solution is now ready for photoactivation using the Adistem photoactivation unit. Photoactivation of the patient's stem cells takes 15 minutes. The patient's activated stem cells are placed into a syringe. Now they are added to normal saline, ready to go back into the patient. The patient's own activated stem cells are returned via an intravenous drip lasting 1 to 2 hours. A natural healing process occurs. Injuries secrete chemokines. Stem cells are attracted to chemokines. This is called homing. The stem cells help regenerate damaged or injured tissue. For more information, please go to www.adistem.com.
Brian and James, I'd like to put this question to both of you. I really don't mind who answers this. No? From where I come from what I hear about stem cell research, there's a lot of ethical issues about this, that whether we should go into tampering with nature so much, using either embryonic cells or adult cells. What is your take on this global discussion over the ethical side of stem cell research? You, the master who speaks only once. Yeah, by the way, James is writing a book called The Master Speaks Only Once. Therefore, he speaks quietly and speaks very slowly, but he speaks only once. So, what's your take on that?
You speak once because the first answer is
It's
a single answer.
Yeah,
You know.
that's his book. This is his book.
About to
This
be
is his
printed. Yeah.
upcoming book. The Master Speaks just once, very quietly. So
Well, that's not me, by the way. The
Oh, that's
master is
Adam's-
you,
yeah.
and you, and you.
All right. So, what's your take on this, James?
This issue hasn't arisen with autologous stem cells. Your own stem cells are taken out of
The word
your
is
own body. Autologous.
Autologous, that means coming from my own cell?
Your own cells.
Yeah.
It's when you take cells from an embryo,
yeah.
The moral issue, the ethical issues arise.
It doesn't hold water.
Well,
if you take cells from the embryonic
from the embryo.
Yeah.
But there's an interesting that they found that very often the stem cells, if you take stem cells from embryonic stem cells, very often, in many cases, you develop cancer tumors.
Yeah, because probably there's a certain amount of resistance in the DNA coding or the genetics of it, because it wouldn't agree. So because you mentioned you can't go in that deep and figure out what the code is. So there would be resistance. But your Adistem doesn't do that.
Right, that's correct. So if your cells know how to fix you, and they know when to stop dividing. So if they're dividing, they're adult stem cells, they're not they don't want to turn into a baby. Whereas embryonic stem cells, if we put them into you, they might fix what's broken. Say they fix your lungs or they fix your knee joint. But the DNA is turned on 100%. So that cell wants to continue to divide and divide and divide and turn into a child. And so unless you can turn off, and that's what induced pluripotent stem cells, they try to turn off some of the DNA to stop that continued division
and
of
that's
the cells.
tampering with nature, and that is dangerous.
That's, it's, for working in the lab, I mean, that's the moral issues of the research institute. We avoid that by using the patient's own cells. We have a different take on, what's going to work clinically. It's your cells are going to work clinically on you.
Great. Brian, I'd like to actually talk to James about this book. I'm really interested in this, about the philosophical side of life now. But before I do that, what's the future of stem cell technology from your perspective, from where you sit at? What do you see happening in the world in terms of stem cell research and application 5 years, 10 years from now?
I think definitely freezing or banking your own cells is going to be very common.
If I'm in my youth, I capture some of my stem cells and store them, so when I age I can reuse them.
That's correct. So they'll have a very young DNA. The telomeres are at the end of your DNA, and as you age they get smaller and smaller and smaller. So if you bank, say, cord blood from a child, the telomeres are very long. So you have a very like as you play a record over and over again, it gets worn down. Same with your DNA.
So I foresee longer lifespans, healthier lifespans.
Yes.
How about death? Could I push it so far that I don't die?
Right now they're regrowing your own organs in the lab. So you could, if something went wrong, if you needed a new bladder, there's a company in America that's growing bladders. So they can replace organs.
You can live up to 200 years. Wouldn't that become really boring to hang out here for 200 years?
Depends if you have good projects to work on, then it's not boring.
Okay, I'm just pushing it back. So James, tell me about this wonderful book that's coming up. You as the compiler, the editor, when the master speaks once, the history of it and what's inside.
Yes. Well, if you ask me how I got into it, I honestly don't know. But I've always been interested in wisdom. I've been aware. I've been sitting at the feet of gurus for many years, since I was about 21.
Any special guru that has influenced your life?
Quite a few of them. But and one, in fact, has given me he's given me a testimonial. And that's a Master Charles, who runs the Synchronicity Foundation in the United States.
And he is of Asian origin, or
he's not actually, but he worked with for many years in India with Swami Muktananda, who is a very famous. You don't know?
I have no idea of these songs.
You should.
Okay.
And anyway, I've been into wisdom for many years, and through a combination of circumstances, I was introduced to a Lao Tzu scholar. And his wife, and he traveled around China for about 8 months, looking for ancient wisdom, Chinese wisdom, from not just philosophers, but also from people people who used to work in for the emperor 1,000 years ago.
Soldiers, farmers, janitors, dancers.
No, definitely not.
No.
Civil servants, because they had to pass this imperial examination system, which was very, very tough. less than 2% passed, and it would take 7 or 8 years to study for this examination. You had to pass that examination to get a job working for the emperor or working in the civil service.
So what's your big picture view? What's
So
the
the big
master's, what's
picture-
the master's view on regenerative medicine? Should we push this further? Should we dig deeper? And should we make an effort to live longer? What's his take on it? The gurus that inspired you to write
Well,
the
it's a
book?
good question. I haven't asked the master that actually.
Yeah.
But what the master, I did ask a question about how we should move ahead strategically, because this is aimed at business leaders, political leaders, entrepreneurs, and I asked the master, which is myself really.
Yeah.
I open, because you pick up the book, you ask a question, and you open the page, and here's your answer.
Yeah.
And the answer was to the effect that there's a burning house, a raging fire in this
Right.
huge house,
Yeah.
and you've got a little cup of water in your hand.
Yeah.
Do you really think you can put out that fire in that burning house
Yeah.
with one cup of water? In other words, the world is plagued by degenerative disease, this huge fire of degenerative,
Wow.
and you with a little bit of money
So should
think
we,
you can make all the changes in two little guys, you know?
so yes or no?
And so the answer was you've got to find somebody else to help you.
Ah, okay.
So
So
we're
we're
go-
going
we're
to call the
going-
fire brigade.
So we're going to go public on the Australian stock market later this year.
Oh, so you're going
To
to
help
increase the size
public.
of that little thing.
Yeah, so there's no longer a little tiny glass of water. It's a much
Become a bucket full of
huge
water,
kind
well
of
of water.
hose pipe, a well of water, yeah.
Your take on this, Brian? Should we push this further? And if yes, how and why? I'm talking of, anti-aging, elongating life, and somehow living longer than we should be.
Well, certainly, the quality of your life is what should be most important.
Most
You know, how
important.
you live your life, but I don't think you can stop the science. I mean, it's happening.
Oh,
It's,
okay.
I think what will happen is that it will be easier for people to get healed, and then they won't have a very, hopefully won't have long degenerative diseases that they have to, just like, when penicillin came around, that guy was thrown out of the hospital. The guy that said, wash your hands before you operate.
I know
They
the
were thrown
story,
out of the
yeah.
hospital. So
Yeah.
I think, that's kind of where we are right now. People don't really believe that this
In
is
terms of
true,
progress.
but it's happening, and from the human evolution, we're always looking to make things
We
better.
can't stop it. Thank you very much for being on the
Thank you,
show,
Raju.
and wish you good luck with all you're doing, and I hope this sells 1 million copies within the year.
Thank you, Roger.
Thank you for being on Expat Insights. So that was James and Brian talking about regenerative medicine. Thank you for watching Expat Insights. I'm your host, Raju Mandhyan. Next week we'll be talking about information technology, and the week after that we'll have the ambassador of Cambodia on Expat Insights. Good night.